St. Lucia's dengue cases have surpassed 500. The alarming upsurge in dengue cases was considered a public health threat some 2 months ago. Public health officials had then expressed concern over the spike of infections in children and teens. National epidemiologist Dr. Michel Francois recently announced that over half of the cases are males, the majority of which are boys.
In August of 2020, the Ministry of Health and Wellness of St. Lucia declared an outbreak of dengue fever. To date, St. Lucia has recorded a total of 503 confirmed dengue cases. Although cases have been identified throughout the island, most of the confirmed cases are concentrated in the northern region in areas such as Castries, Bexar, and Central Babonneau. 53% of the cases are male, indicating a slightly higher occurrence in the male sex. The age group 5 to 14 years accounts for approximately 39% of cases, of which 57% are male. A total of 128 confirmed dengue cases have been hospitalized. 56% of these hospitalized cases are male, of which the less than 14-year age group is most affected.
While all 4 types of dengue fever have been previously recorded on the island, this year types 2 and types 3 are prevalent. They account for 14% of the 3% of cases respectively. Dr. Francois says persons with fever which persists beyond 5 days may develop more severe symptoms.
In its more severe form, persons may experience bleeding from the gums or nose, vomiting blood or passing blood in the stool, and/or severe abdominal pain. There is no vaccine or specific treatment for dengue. Management is strictly supportive based on presenting symptoms. The simultaneous infection of individuals in the same household has been noted in this outbreak of dengue fever. It is important to note that dengue fever cannot be transmitted from one person to another in the absence of the Aedes aegypti mosquito. An infected individual and the mosquito are both required for the transmission of dengue fever.
Health officials continue to stress the importance of prevention and control measures to curb the spread of infection.
The public is reminded of the measures to reduce the mosquito population, such as removal of all open containers with stagnant water in and surrounding your home on a regular basis, such as flower plates, pots, and used tires. If that is not possible, water containers can be treated with larvicides. Tight control of water containers, barrels, wells, and other storage tanks. Use of window or door screens by the population wherever possible. There are also measures which can be adopted to prevent the bite. These include the use of repellents and wearing of long-sleeve shirts and long pants, especially during the hours of highest mosquito activity.
St. Lucia is not the only country in the region which has declared a dengue outbreak. The French Caribbean is also battling with outbreaks amid the ongoing pandemic. St. Vincent has confirmed 4 deaths. Joachim Duplessis, HTS News Force.